Okay, hi there again. Peace. I'm here and I'm going to tell you about the thyroid gland. The thyroid gland is an endocrine gland, that is, it secretes hormones which are secreted directly into the blood. Exocrine glands secrete hormones through ducts. Endocrine glands are ductless glands which do not have ducts. So it is an endocrine gland and it is a bilobed structure which is present right above your trachea. Forgive my inappropriate handwriting. It is above the trachea, and the two lobes are connected through the middle part, which is known as the isthmus. You can see over here, this is your sternum, the manubrium of your sternum, the bone, your chest bone. These are your clavicles. These are your sternocleidomastoid muscles of the neck. This is your hyoid bone. This is your thyroid cartilage, and this is your trachea. And this is your thyroid gland over here, right in your neck region. Now, the thyroid gland is encapsulated. It has capsules. It has a false capsule and it has a true capsule. The true capsule is by the own gland's tissues. It's made by the gland by itself. So that's why it's called the true capsule. The false capsule is called so because it is not the gland's own, but it is in fact made by the layer, the pretracheal layer of the deep fascia. Deep fascia are the deep fascia of your neck. These are the layers of your neck. As you can see over here, this is the pretracheal layer of the neck. It is like a sheet that covers the things inside your neck. It is all around. This is a cut section. This is the thyroid gland, the isthmus of the thyroid gland, and it's covered in the capsule. It's encapsulated by the pretracheal fascia. Here you can see it again. Thyroid gland on the trachea. Here it is. This is your superior vena cava. This is the arch of aorta, and your vessels are traveling up. And you see, this is the thyroid gland. This is your trachea, and this. Can you see that? This is the front of your thyroid gland, and the back of it. This is your posterior view from the posterior side of the neck. This is your esophagus. As you can see, it's highly muscular structure. This is your pharynx, the pharynx constrictor muscles extra. This is your trachea. These are cut sections, and these small balls that you see, they are the superior and inferior parathyroid glands. Now, for a little histology about the thyroid gland. As I said, the thyroid gland is an endocrine gland. It has two types of cells basically. This is like a histological section, and you have the pink colored, the colloid cells. These colloid cells, there are the main cells of the thyroid gland, and they secrete thyroglobulins. Thyroglobulins are the thyroxine and triiodothyroxine. It's the T3 and T4 hormones that are secreted from the thyroid gland, and these are the main hormones of the thyroid gland, and they act like growth hormones, and they're extremely important. Deficiency of them could cause goiter and several other diseases. The other cells that we have in our thyroid gland are the green ones, that are the smaller ones, that are the parafollicular cells. These are follicles, and these are parafollicular, that means around the follicle cells. The parafollicular cells secrete calcitonin, the hormone calcitonin, which is the friend of the bone. You can see over here, there's also a histology section of the thyroid gland. These pink big things, these are the main cells, that is the colloids or follicles. These are the thyroid follicles with the colloid cells, and the small baby, baby purple dark stained spots you see, these are the parafollicular or C cells, as the C cells cause they secrete calcitonin. I already told you that the follicles or the colloids secrete the T3 and T4, whereas the C cells secrete the calcitonin. Calcitonin is a friend of the bone. It causes calcium deposition on the bone and is also an important hormone. Now it is important, as I have written over here, my sir told me that lung K cells also release small amount of calcitonin as well. So yeah, it's a small amount, but maybe it's important. And then comes the blood supply of the thyroid gland, which is by the superior thyroid artery, the superior part of the thyroid gland. Superior thyroid artery is a branch of the external carotid artery, and external carotid comes from the common carotid, which again comes from the aorta, which is the largest artery in the body. And the inferior part of the thyroid gland is supplied by the inferior thyroid artery, which comes from the thyrocervical trunk of the subclavian artery, which comes again from the aorta. And then there is also a partial thyroidea imma artery, which comes from the brachiocephalic, that is the arch of aorta. Now for the venous drainage, it is the same like superior thyroid vein, middle thyroid vein, and inferior thyroid vein. These superior and middle thyroid vein, they all drain into the internal jugular vein, while the inferior thyroid vein drains into the brachiocephalic vein. As you can see here, it is a really rough diagram, but thyroid gland, the superior part, superior thyroid vein, and the middle thyroid vein, they go into the internal jugular vein, and they come into the vein, the brachiocephalic vein, and then this the inferior thyroid vein also comes into the brachiocephalic vein, and this is the internal jugular vein, and this is the subclavian vein, and then the brachiocephalic vein, both sides join to form the superior vena cava, which it drains into the heart. You can see over here as well the superior thyroid artery. It is coming from the external carotid artery down to the thyroid gland, and it supplies the superior part of the thyroid gland, whereas the inferior part is supplied by the inferior thyroid artery. As you can see over here, inferior thyroid artery is a part which is coming from the thyrocervical trunk of the subclavian artery. As you can see, this is the subclavian, and this is the thyrocervical trunk, which gives to the inferior thyroid artery, and it supplies the inferior part of the thyroid gland. And in the veins also you can see the inferior thyroid veins. See over here, they drain into the brachiocephalic vein, which is this, and then it comes into the superior vena cava. Similarly, the superior thyroid veins, this is the superior thyroid vein, it drains into the internal jugular vein. As you can see, this is the superior thyroid vein, it goes into internal jugular vein, and so does the middle thyroid vein go into the internal jugular vein, and it comes to the brachiocephalic vein and into the superior vena cava. The last point to be noted in this really short topic is that the lymphatic drainage of the thyroid gland. The lymphatic drainage is where all the lymph goes from the thyroid gland, which is these small lymph nodes you see over here on the trachea. These are the pretracheal lymph nodes, as you can see over here, pretracheal lymph nodes. they are the lymphatic drainage of the thyroid gland, and if they enlarge, that means there is some disorder in the thyroid gland, obviously. And here I'm done with my thyroid gland, and it's the same thing as I said in my first video, that I use the Nature's Atlas and the BD Chaurasia and, well, my own notes, I guess. And so laters, I guess. And yes, it is 7 a.m.